Welcome to week 28 and your third trimester. You're in the home stretch now. Your baby is now as big as a plate of pancakes. Your little guy is almost 15 inches long and weighs about 2.2 pounds. Now he's going to really start packing on some serious weight, about 1 pound every 2 weeks. All that baby weight will fill out those chubby cheeks, but will also act as padding for his organs and help regulate his body temperature after birth. You might feel like your belly is ready to burst, but your baby still has some important growing to do. You'll probably be seeing your midwife or OB every 2 weeks now to keep close tabs on things. Bet you're dreaming about what life will be like when your baby gets here. Guess what? He might be dreaming about it too. Baby is now capable of REM sleep, the stage where dreaming occurs. A common source of discomfort at this stage is sciatic nerve pain. This occurs when the baby and your uterus rest on the sciatic nerve in the lower part of your spine, putting extra pressure on the nerve and causing a shooting pain, tingling, or numbness that starts in your bum and radiates down the backs of your legs. The pain can be intense, but may pass as your baby moves around, or in more serious cases, it can linger until delivery. A hot water bottle, a warm bath, rest, and stretching can help you get some relief. Another common symptom at this stage is shortness of breath. If you feel like you've run up a flight of stairs when all you've done is walk down the hall, don't worry, it's normal. This is partially due to an increase in the hormone progesterone, which tells your brain that you need to take in more air, enough for two. Plus, the weight of your uterus on your diaphragm can make breathing feel harder. Slow down and pay attention to your posture. Standing up straight creates more room for your lungs to take in air. Call your practitioner if your shortness of breath seems severe, you have chest pain, or your lips or fingertips take on a bluish tinge. Do you have a dog? Welcoming a baby into the family is a big step for you, and for him. Fetal will likely know that something is up by now, based on the change in your scent and the shift in your behavior. Now's the time to check in with a dog trainer about any behavioral problems like jumping, barking, and aggression. If your dog hasn't been around kids much, you can help acclimatize him by going on a few outings with a mom friend. A little practice with walking your dog on a leash with a stroller will be good for both of you too. Plan to introduce your newest family member slowly by sending home a blanket with your baby's scent in advance. This will help your dog get used to the new little person before he comes through the door. Make the introduction slowly and be prepared for many sweet moments ahead. You may be surprised by how easily your pup adopts the new baby as a member of his pack. Congratulations, you're going to be a great mom. Welcome to week 29. Your baby is now as big as a head of broccoli. She can smile, blink, and even frown or cry in utero. Though some women feel great for their entire pregnancy, there are others who are hit with every symptom in the book. Constipation, hemorrhoids, headaches, heartburn, indigestion, and an itchy belly. It's a lovely laundry list of indignities. Luckily, most of these complaints are temporary and will improve once you have the baby. It's tempting to throw in the towel on your workout regime toward the end of your pregnancy, but do your best to stick with it. If your achy joints are bugging you, consider a water workout. The water will support your expanding body and loose joints. Getting regular exercise will help ease aches and pains, help you sleep better, make you stronger for delivery, reduce your risk of delivery complications, speed up post-birth recovery, and boost your mood. Creating a birth plan is a comforting activity for some mums-to-be. Envisioning how childbirth will go feels like a little bit of control in an otherwise uncontrollable situation. For others, it's an anxiety-inducing exercise that's better left to the pros. Neither outlook is right or wrong. You should do what feels right for you. Just keep in mind that not all births go according to plan. So even if you detail the day down to the labor playlist, special mood lighting, and socks you're gonna wear, it's best to research alternatives so you'll know what you're dealing with in any scenario. Lots of expectant parents are torn on the topic of stem cell collection, often called cord blood banking. Stem cells collected from the umbilical cord at birth can potentially be used to treat various illnesses. But this service comes at a price, including a hefty initial fee and a monthly storage cost thereafter. If you decide on stem cell collection, look into which stem cell companies service your area and make arrangements for collection. Some communities have free public banks where you can donate your stem cells. Have you heard about kegels yet? Kegels are exercises that strengthen your pelvic floor muscles and have been known to make a huge difference in the likelihood of having pelvic floor weakness, postpartum incontinence, and even vaginal prolapse post-baby. You can tell where these muscles are by imagining you're trying to stop your pee midstream. You can get in a Kegel workout no matter where you are. Squeeze for 4 seconds, then release for 4 seconds. Repeat 10 times, a few times a day. Congratulations, you're going to be a great mom. Welcome to week 30. Your baby is now as big as an eggplant. She's pretty tired from all that growing she's doing. She's sleeping about 90% of the time. Now that you're well into your third trimester, your body will start to get ready for birth. You may notice your boobs are getting even fuller, potentially heavier, and more tender in preparation for breastfeeding. They may look like a road map of dark veins, and the small glands on your areolas may become raised. Don't be surprised if you're binge-watching TV one night and your belly suddenly becomes uncomfortably rock hard. Chances are it's just a Braxton Hicks contraction. These mild contractions are your body's way of practicing for birth. Just pay attention to how often they happen. They should be irregular, not progressive in terms of intensity, and spaced relatively far apart. If you're expecting a boy, your practitioner will ask you to think about where you stand on circumcision. This preference often depends on your cultural and religious background. Circumcision was pretty popular for baby boys born in North America in the 70s and 80s. However, rates have been falling and it's no longer routinely recommended. You usually have to return to the hospital at a later date to have it done. Discuss it with your partner and read up on the latest guidelines. Sure, it's fun to buy cute baby booties, but the car seat should really be at the top of your shopping list. Some hospitals won't even let you leave without one, even if you don't have a car. There are a lot to choose from, but you just need an infant rear-facing seat, also known as a bucket seat for now. You can also buy a convertible car seat that will see them through their toddler years. Buy it new, not used, and follow the installation instructions carefully. Some stores even hold workshops with a certified car seat instructor to help you do it right. It's not easy. It's time to get the baby gear assembled. It may take a few Saturdays to get the nursery completely finished. Plus, you're probably going to slow down soon. It's tiring carrying all those extra pounds. Congratulations, you're going to be a great mom. Welcome to week 31. Your baby is now as big as a tub of ice cream. He's getting stronger too, so be prepared for him to be more active this week, especially since he isn't out of room just yet. It will probably feel like he's doing a bar class in there as he stretches and exercises his limbs. Has your belly button popped yet? If it hasn't already, it's coming. The pressure of your expanding uterus on your abdominal wall will cause the protrusion of your belly button. It will return to its pre-pregnancy state, albeit probably a bit saggier after delivery. Heart palpitations, when it feels like your heart is racing or skipping a beat, are pretty common in late pregnancy. They're your body's reaction to changes in circulation, to carrying around a bulge the size of a bowling ball, and sometimes to anxiety. Take a break and do some deep breathing until you feel your ticker stabilize. But get in touch with your doctor if the palpitations are accompanied by chest pain or shortness of breath, or if you're worried that they're happening too often. With a looming life change ahead, some mom-to-be worries are to be expected. No big deal, you'll just be completely responsible for another human being. But for some women, this anxiety crosses the line. If you find yourself sapped of the joy of pregnancy, or if you never had it to begin with, or you're spending too much time dwelling on the what-if scenarios of pregnancy and childbirth, it's time to talk to your doctor. Believe it or not, you should think about packing your hospital bag as early as 30 weeks. It's just one less thing to worry about, and it means that you're ready to roll if your baby decides to make his debut a few weeks early. Still feeling frisky? We've all heard the stories about women who have gone into labor after a good romp between the sheets. But fear not, an orgasm won't kickstart premature labor. Even at full term, sex will only help get things going if they're gonna happen soon anyways. That said, don't be surprised if you experience Braxton Hicks afterwards, because the oxytocin released during sexual arousal can make the uterus contract. One word of warning: if you experience any signs of premature labor, like 5 or more strong contractions in an hour, or suspect that your water has broken, it's best to avoid sex until your doctor has checked you over. Congratulations, you're going to be a great mom. Welcome to week 32. Your baby is now as long as a zucchini. Her tiny little fingernails have grown to the top of her fingertips. Soon she'll be turning face down to get into position for her big exit. Don't be surprised if you look in the mirror one day and see stretch marks on your thighs, boobs, or belly, even if you've been diligent about moisturizing and haven't seen a single one of those reddish-purple marks until now. Your baby is growing at a rapid pace, stretching your skin at a much faster rate than in the earlier stages of pregnancy. Don't worry, stretch marks usually fade to silvery lines that you'll hardly notice in a few months. Many women feel lightheaded throughout pregnancy. By the 3rd trimester, you may feel dizzy when lying on your back because in this position, your heavy uterus is weighing down the main blood vessels of your torso, reducing blood flow to your brain. Turning to your left side should help you feel better. Have you thought about who's going to be in the room during your labor? Your mom, sister, and other close friends and family members might express an interest in attending the birth, but you're calling the shots on this one. Some women only want their birthing partner by their sides, while others are okay with an entourage. Is your partner calm in stressful situations, or will he or she need someone else there for support? Think about your family dynamics too. Does your mom generally raise anxiety levels in the room, or is she great at using humor to distract you? Check with your hospital or birthing center on the delivery room rules and visitor policy. The same thing goes for professional doulas and birth photographers. Know what's allowed ahead of time. Have you Googled what's an episiotomy? Many first-time moms who've heard too many childbirth war stories worry about needing this procedure, where the doctor makes a surgical cut in a mom's perineum to allow more room for the baby's head to emerge. But fear not. Doctors try not to do them unless absolutely necessary, because they don't actually heal that easily. It's more likely that birth will cause you to tear a little naturally and somewhat unevenly instead of a hard-to-heal surgical cut. You may require a few stitches to close the injury, but they'll numb the area before doing the stitches. To avoid tearing altogether, you can try perineal massage in the final weeks leading up to the birth to make the area more pliable. Congratulations, you're going to be a great mom. Welcome to week 33. Your baby is now as long as a small leek. Her organs are now pretty much fully developed, though her lungs still need a bit more time in the oven. She's developed her own immune system too, which will come in handy when she joins our germy world. Don't be surprised if you start to experience tingling, aching, or numbness in your fingers, hands, and wrists. As your body retains fluid, the tissues in this area can swell and put pressure on your wrists. It can be a one-sided irritation or affect both hands. Take breaks to stretch and try to sleep with your hands in a relaxed position, resting on pillows. When it comes to hair, the upside to pregnancy is that you're probably enjoying a shiny, strong mop that's growing faster than ever before. The downside? You may find that hair is sprouting in unfortunate places you're not used to, like your face, back, nipples, and belly. Not all hair removal techniques are safe during pregnancy. Your best bets are threading and tweezing because neither requires chemicals, but both give you longer-lasting results than shaving. Sugaring and waxing are okay as long as your skin hasn't been too sensitive. Bleaching, depilatories, and laser hair removal are no-nos because there haven't been enough studies to confirm their safety for your baby. By now you may have heard of placenta encapsulation, where moms have their recently delivered placentas dehydrated and turned into pills that they can take for extra postpartum nutrition. There isn't a lot of evidence that these pills actually boost energy levels, aid in recovery, or prevent postpartum depression. You'll have to pay a placenta encapsulation service to dehydrate the organ and turn it into pill form. If you're considering having placenta pills made, talk to your doctor or midwife. And it's possible for a baby to get sick from group B streptococcus in the pills. For many new parents, the stroller is a big-ticket item. If you live in a city and a stroller is going to be your main mode of baby transportation, you're weighing comfort and price against size. If you live in a community with a lot more driving, you're going to want to think about how easy it is to fold up the stroller and put it in your trunk, how much it weighs, and whether it's compatible with your car seat. Congratulations! You're going to be a great mom. Welcome to week 34. Your baby is now as big as a pineapple. Your baby's about 2.1 kilos, or 4.7 pounds, and almost 46 centimeters, or 18 inches, long. He's still moving lots, but the movement will feel different. Less kicking and more wriggling, because that kid is most definitely out of room. Your baby's hearing is fully developed now too, so get your lullaby on or let your partner read a book to the bump. You've probably heard moms complain about swelling, especially in the summer months, but extreme puffiness can be an indicator of preeclampsia. If you notice pronounced edema, a fancy phrase for excessive swelling, especially if it's accompanied by headache, blurriness, or flashing lights in your vision, hightail it to the hospital and have the doctor check your blood pressure and for protein in your urine. Preeclampsia will resolve after the baby is born. Make sure that you have breast pads on hand from here on out because your boobs have figured out their new job, feeding a baby, and may start to leak. The liquid you're noticing is colostrum, the nutrient-rich substance that precedes milk, and this pre-delivery leakage is nothing to worry about. Speaking of leaks, you may also notice more vaginal discharge. This is a result of increased blood flow to your pelvis, spurred on by the estrogen racing around your body, as well as the extra pressure of your growing baby. Panty liners are your friends. Pregnancy affects women differently in terms of sex drive. Some women notice an increase in desire, while others would rather walk over hot coals. In the third trimester, many women feel uncomfortable and tired, so sex is the last thing on their minds. Hormones also factor in, making some women hypersensitive, even to the point of vaginal discomfort. If you're not feeling it, that's okay. Your sex drive will probably show up again in a few months' time. But if there's even a glimmer of passion, try to nurture it. Embrace your gorgeous curves and enjoy some pre-baby intimacy with your partner. If you're considering co-sleeping or bed sharing with your baby, do your research on the pros and cons. Read up on the risk of sudden infant death syndrome and make sure that the sleep environment will be as safe as possible. If you're planning to breastfeed and haven't gotten a breast pump yet, it's time to think about it. Rent a medical-grade pump from your hospital or from a baby supply store or research models to buy. An electric pump is definitely faster than a manual pump, which you do by hand, but it's more expensive. Make sure to open your new pump, assemble it, and account for all the pieces it requires. The last thing you want to be dealing with is missing breast pump components, especially when you have rock-hard boobs engorged with milk and a sleeping baby. We know it looks complicated, but it's not as bad as it looks. Congratulations, you're going to be a great mom. Welcome to week 35. Your baby is now as big as a supersized soda. From now on, your baby won't get much longer, but she'll continue to pack on weight, up to a ½ pound of adorable baby chub each week until you give birth. Your discomfort is probably ramping up too. Back and pelvic pain are common. Try making sure that you bend with your knees if you're lifting something, walk or swim for 30 minutes a day, avoid long stretches of standing, sleep with a body pillow between your legs, and roll like a log rather than twist awkwardly when you get out of bed. Family harmony is often about managing expectations. Have an honest talk with your partner about what you both want when it comes to visitors during those early weeks, and make sure that your loved ones are clear on your wishes before the baby arrives. Do you want it to be just your own little family while you recover? If you're figuring out nursing, you might be pretty much topless for a week or two. Or would you rather have the grandparents at your house for an extended stay? Be warned that the all-hands-on-deck help from well-meaning relatives sometimes comes with a side of unsolicited parenting advice at a time when you're feeling sleep-deprived and sensitive. Did your latest appointment suggest your baby is in a breech position? This means your baby could be bum first or feet first over your cervix instead of being positioned head down. Most breech babies move to the head down position on your own, so don't panic. Around the 34 to 36 week mark, there are things you can do to encourage your baby to shift. Rock gently on your hands and knees or lie in a child's pose to help relax the pelvic muscles and let gravity go to work. You can also do a pelvic tilt, lying on your back with your knees bent and feet on the floor and raising your hips. There are also some alternative treatments such as acupuncture or a procedure called external cephalic version, ECV. Think about how you're going to streamline some household stuff in the days after your baby arrives. Maybe this means freezing some favorite meals, signing up for a food delivery service, or hiring a short-term helper, like a neighborhood kid who can walk the dog. Congratulations, you're going to be a great mom. Welcome to week 36. You're now in your 9th month. Your baby is big as a baguette. Your baby is continuing to gain weight, and she's moving farther down into your pelvis. Maybe you'll hear people saying, "Oh, the baby's dropped." This creates pressure on your pelvis, not the most comfortable feeling. You may also experience lightning crotch, a non-medical but sadly very accurate name that some moms use to describe short, sharp pains in their vagina, rectum, or perineum as their ligaments and muscles cope with the baby's movement and weight. If the pain is ongoing, check with your midwife or doctor. There's not much you can do about it other than try different positions to feel more comfortable. But the upside is that your lungs have more room again and you can breathe more deeply. Restless leg syndrome, RLS, which is jittery legs or a painful crawly feeling during the night, can also kick in during late pregnancy, if it hasn't already. Before bed, stretch your legs, get a massage from your partner, or enjoy a warm bath. Bedtime is also a good time to take your calcium supplement or drink a glass of milk, as calcium seems to reduce RLS. Your prenatal appointments will probably increase to once a week during this final month. Between weeks 35 and 37, you will likely have a Group B streptococcus, GBS, test, where your practitioner takes a swab of your vagina and rectum. She may also check your urine for this bacteria. GBS isn't a big deal for you, but it can be serious for your baby, potentially causing sepsis, pneumonia, or even meningitis, if it's passed on during labor. If you test positive, you'll be offered antibiotics through an IV during your labor. Thinking of creating a labor playlist? Think about what music relaxes or motivates you. You probably haven't seen your feet or nether regions for weeks. Are you considering some hair removal before the big day? We can assure you that your birth team will definitely not care, but if it makes you more comfortable, go for it. Shaving after 36 weeks isn't recommended due to an increased risk of infection from tiny cuts if you end up needing a C-section. Trimming is recommended over waxing or depilatory creams because your skin is so sensitive during pregnancy. Of course, going au naturel is totally fine too. Congratulations, you're going to be a great mom. Welcome to week 37. Your baby is now as big as a pie. Brain development is super important in these final weeks. Your baby's brain will almost double in size between weeks 35 and 39. Most importantly, though, she's continuing to make a substance called surfactant in her lungs, which helps the lungs inflate with the first intake of air and keeps the lungs from sticking together as the baby exhales. Babies born prematurely may be given surfactant when they're born to help with their breathing. As your baby has less room to move, she may not be as active as she has been. Your midwife or doctor may ask you to start counting kicks. This means counting the number of times your baby moves, hoping for about 10 kicks in 2 hours, to make sure that everything is on track. Hormones that help relax muscles in your body are also relaxing your intestines, which slows everything down. Plus, your growing baby is taking up more space, giving your digestive system less room and making you more prone to constipation. Be gentle when you're going number 2 because straining can cause hemorrhoids, itchy, painful, swollen veins in the anus. Fun times! Talk to your practitioner about ointments or stool softeners to relieve the discomfort. Braxton Hicks contractions often ramp up during late pregnancy too. These don't dilate your cervix, but they can be painful. Drink lots of water, mild dehydration can be a trigger, and practice deep breathing. Also, try a warm bath or a hot water bottle on your abdomen. In the last month of pregnancy, many moms-to-be find that their nesting instinct kicks into overdrive, with lots of cleaning, cooking, and general prep for the new arrival. One productive nesting task is to set up a few mini stations for feeding or diaper changes, especially if your home has more than one floor. If you've started your mat leave, this is a great time to get some appointments out of the way. Book a haircut or even a teeth cleaning. A mani or pedi is also a totally doable luxury, especially when you haven't been able to see your feet for weeks. But some hospitals have a no nail polish rule if you're having a C-section, so check on the policy first. Parents with babies who are close in age to yours are amazing resources and may become new friends too. Research baby groups and classes in your area, or venues like mummy and baby movie screenings, baby-friendly cafes, and drop-in centers for when you're ready to go out again. Now's the time to exchange contact info if you've hit it off with a cool mom-to-be at a prenatal class. Congratulations! You're going to be a great mom! Welcome to week 38. Your baby is now as big as a serving of cotton candy. You may feel like you're ready to pop, but your baby isn't considered full term yet. That happens next week. In the last few weeks inside the womb, your baby's brain, lung, and liver are still developing. For example, a baby born before 38 weeks has a higher risk of jaundice because her liver is less efficient. Want to hear the grossest of all pregnancy terms? Mucus plug. Mucus near the cervix protects the baby from bacteria, and losing your mucus plug, also known as the bloody show, is a sign that your cervix is beginning to soften in preparation for labor. As the cervix begins to dilate, the discharge may be clear or blood-tinged, and it might come out right before active labor starts or a few days before. Not every pregnant woman sees her mucus plug coming out, so don't worry if you don't notice anything. Your amazing body has been through a lot. It's grown a human, and it's about to go through even more. You can do some TLC prep now to help you feel better after you've given birth. If you've already bought a box of extra big maxi pads to absorb the postpartum bleeding, known as lochia, take a few and make some padsicles. Just pour some water and a spritz of witch hazel onto them and freeze them. If you freeze them in the bottom of a large bowl, they'll freeze in a more natural, rounded shape. You'll appreciate the soothing coolness on your lady parts after you've delivered the baby. A sitz bath, a plastic basin that fits over the toilet bowl, which you fill with lukewarm or cool water and a pinch of Epsom salts, can help with post-delivery healing and swelling too. Pee stings when your vagina is healing, so use a plastic squeeze bottle filled with warm water to rinse as you urinate. Also, if you plan on breastfeeding, it's a good idea to have some nipple cream on hand. If you've written a birth plan, take a few minutes to review it. Any changes you want to make? Jot down any questions you'd like to ask at your next appointment. At this point, your baby could come tomorrow, or it could be another 3 or even 4 weeks. Congratulations, you're going to be a great mom. Welcome to week 39. Your baby is now as big as a bag of flour. By now, your baby weighs about 3.2 kilograms, or 7 pounds, and is about 51 centimeters, or 20 inches long. The bones in his skull haven't fused together yet. Rather, they're separated by membranes, which allow it to squeeze more easily through the birth canal. His stomach is tiny, about the size of a large marble, so he won't need much breast milk or formula to satisfy him for the first few days after birth. When your doctor or midwife examines you, she will use her fingers to check if your cervix is dilating yet. She may ask you if you want a cervical or membrane sweep, where she puts a finger into the cervical opening to separate the amniotic membrane from the cervical tissue. Chances are this will hurt a bit, but it's considered a low-risk way to encourage labor because the sweep tells the uterus to start producing prostaglandins, which soften the cervix. Chances are right now that every weird feeling feels like it could be the start of labor. Aside from contractions, rhythmic, repeated cramps, some signs of labor include the baby dropping further into your pelvis and throbbing back pain. Nausea and diarrhea are also possibilities as your muscles, including those in your intestines and rectum, loosen as labor approaches. You may also lose what's called a mucus plug. Mucus near the cervix protects the baby from bacteria, and losing your mucus plug, also known as the bloody show, is a sign that your cervix is beginning to soften in preparation for labor. Your water may break, either in a gush or a trickle, and kick off labor, or your water could break after contractions have already started. look at a cheat sheet of different labor positions to try. While TV tends to show a laboring woman on her back in bed, there are actually lots of different moves that may be more comfortable and will still keep things moving. You can lean into a wall or over the bed, sit on an exercise ball, slow dance with your partner with your head leaning against his chest or shoulder, do a lunge or lie on your side with your upper knee bent. There are also a lot of labor props, such as birthing stools, squatting bars, and tubs. If you're having a planned C-section, it may be scheduled for week 39, because that's when your baby is officially full term. In some hospitals, they do gentle C-sections, where there isn't a curtain between you and the baby, or the baby is laid on your chest for immediate skin-to-skin contact. Ask your doctor in advance if these adjustments are possible. Congratulations, you're going to be a great mom. Welcome to week 40. Your baby is now as big as a watermelon. Her eyes are open when she's awake, but they're closed when she's sleeping. Her hair and nails are still growing. Are you feeling anxious, excited, huge, uncomfortable, irritated, mellow, exhausted? That's all part of these final few days. About 85% of babies are born within a week of their due dates, so hang in there. Sore ribs? Your rib cage has probably shifted to accommodate your baby, who might be causing pressure and pain as she moves and kicks. It's okay to give that baby hand or foot a firm nudge. Leaning back in a chair or applying a cold pack to your ribs might ease the ache too. You might have an ultrasound this week to check on your baby's growth, movement, and your amniotic fluid level. Your doctor may also order a non-stress test, which monitors the baby's heartbeat. If everyone from the crossing guard to your barista is sharing tips on how to kickstart labor, it helps to know which ones have science to back them up. Pineapple, spicy foods, castor oil, and red raspberry leaf tea are traditional methods, but they tend to fall into the old wives' tales category. Sex can, in fact, lead to labor. If you have a male partner, good news. His semen contain prostaglandins, which help soften the cervix, while your orgasm releases the hormone oxytocin, which signals the uterine muscles to contract. Skip sex, though, if you're bleeding or your water has broken. Nipple stimulation to bring on uterine contractions may help start labor, but research shows that it can actually cause more contractions and a more intense labor. Double-check the pre-baby prep details, making sure that phones are charged and that there's a charger in your bag, and if you have a car, that it's gassed up and ready to go. Congratulations! You're going to be a great mom. Welcome to week 41. Your baby is now as big as a pumpkin. At 1 week overdue, you have probably literally said, "What is going on in there?" By week 41, your baby is typically about 3.6 kilograms, or 7.9 pounds, and 52 centimeters, or 20.3 inches long. His skin may be starting to peel a bit after such a long soak in amniotic fluid. Now officially past your due date, you're probably feeling pretty over it. Only about 10% of women don't give birth by the end of the 41st week. Your doctor or midwife will continue to monitor you and your baby carefully. A small percentage of overdue babies will have health problems, possibly because the placenta is getting older, which means fewer nutrients and less blood and oxygen are reaching the baby. This is why your midwife or doctor will want to talk to you about inducing labor if you don't go into labor spontaneously soon. About 1 in 5 women have induced labors, although some are due to health complications like preeclampsia, not an overdue baby. Induction carries a higher chance of intervention, such as forceps or vacuum delivery. So if you are with a midwife, your care may be transferred to a doctor. Your midwife may still be able to assist with labor and delivery, depending on your hospital's policy. If your cervix hasn't started to soften, your doctor may apply a prostaglandin gel directly to help dilate it, or may insert a Foley catheter into your vagina and inflate the catheter to stretch your cervix, followed by an IV drip of Pitocin, which mimics the hormone oxytocin, to start contractions. In natural labor, the contractions increase slowly, but induced labor can be more painful because the contractions are faster and more regular. Either way, you'll get to meet your baby soon. Congratulations, you're going to be a great mom. Welcome to week 42. Your baby is now as big as a small turkey. That little turkey is clearly comfy in there, even if you're not. Her skin is probably dry, cracked, and peeling in spots, especially on her hands and feet, because she has shed much of the vernix coating on her skin and has been soaking in the amniotic fluid. Her nails may be getting long enough to extend past her fingertips, and she likely won't have much of that fine, downy hair that covers babies in utero. She may have more hair on her head, though. Backaches, pelvic pressure, leg cramps, and difficulty sleeping are all very common at this stage of the game. You may also be feeling stressed, frustrated, and impatient. But take heart, the wait is nearly over. Look at it this way. You're hopefully off work, everything is ready, and you're going to be very, very busy very soon. Savor the peace and quiet, and try to ignore everyone messaging you. Chances are good that your baby is completely healthy, but at 42 weeks you're at a higher risk of complications like low amniotic fluid, problems with the placenta, and a pinched umbilical cord. Your healthcare provider will keep a close eye on you and your baby through ultrasounds, cervical checks, and heart rate monitoring. If you don't go into labor naturally this week, your doctor or midwife will induce. Methods include breaking your water. We'll warn you, sometimes they use a device that looks like a crochet hook. Doing a cervical sweep, where your doctor uses a finger to swipe around the amniotic sac and release hormones that start contractions. Applying prostaglandin gel to your cervix to dilate it, or giving you a Pitocin IV, which mimics the hormone oxytocin to start contractions. You may be worrying about a long labor, one of the possible side effects of induction. Obviously, you can't control the length of your labor, but there are some things you can do to conserve your strength. Moving around, taking pain meds to get you over the hump, doing breathing exercises, and having a supportive partner and birth team can go a long way. The sweetest approach? Focusing on that baby you'll soon be holding in your arms. Congratulations, you're a great mom.